Hello everyone, welcome to the 2020 West Michigan Wellness Symposium webinar series. I'm Gima Sarge-Bono. I'm the Executive Director for the American Heart Association in West Michigan. The AHA's highest priority is to keep our community safe and healthy, so we've worked to bring the annual West Michigan Wellness Symposium to you virtually through this online webinar series. What is the purpose of the West Michigan Wellness Symposium? Because work plays such a significant role in our lives, it's important to recognize its impact on health and overall well-being. The AHA has been working with many local company leaders in West Michigan to develop this wellness symposium as an informal place for HR professionals and company leaders to discuss the most current issues that are out there, creating a healthy workplace. The AHA is committed to forging ahead with events such as the Wellness Symposium because chronic disease and health disparities haven't stopped due to COVID-19. As a matter of fact, COVID-19 has increased the urgency around the dialogue of prevention and building healthier lives for all. We know that the focus on prevention and a culture of health and well-being in the workplace can really be a significant driver in helping to build a healthier, more equitable community for all. So we're very excited to present the Wellness Symposium series to you in this virtual format. I'd like to thank our presenting sponsor, Meyer, and our other sponsors, Feist Electric, Priority Health, and Terryberry for making this Wellness Symposium series possible. This is session 2 in the series, and today we're welcoming Kevin Voss and Dr. Kristi Artz from Spectrum Health to talk a little bit about their culinary medicine program and the importance of healthy food options in the workplace. Kevin and Dr. Artz, will you please introduce yourselves and tell us a little bit about what you do at Spectrum Health?
Hi, and thanks for that introduction. It's great to be here today. I'm Dr. Kristi Artz. I am our Medical Director for Lifestyle Medicine, which includes our Culinary Medicine program at Spectrum Health. By training, I'm an emergency medicine physician. So over many years of practicing emergency medicine, seeing patients in their sometimes worst moment, and much of this related to chronic disease has really led me to this path of building awareness and creating better programs around true prevention and how we can use food as medicine. It's a really powerful tool. So thanks for inviting me to be here.
And Kevin.
And my name is Kevin Voss, and I'm so pleased to be here today with you to talk about this important topic of improving nutrition in the workplace. My role at Spectrum Health is Senior Director of Hospitality Support Services. And support services in a hospital, traditionally you think of environmental services or the cleaners in a hospital and nutrition services. And the nutrition services role that I have of leading the nutrition services team is really the impact that I can have around improving workplace nutrition. So nutrition services encompasses approximately 100 registered dietitians that provide nutritional analysis and education while you're in the hospital and outpatient, but it also involves feeding patients when they're in the hospital. And an even greater impact is running our retail food outlets, or often thought about in hospitals as cafeterias. One interesting fact is that out of 10 meals that we serve at Spectrum Health, 8 of them are actually served in the cafeteria. So the impact of those 8 meals is great on our workforce. And of those 8 meals, 7 of them are bought by our employees, and the other 1 is bought by a visitor. So what we serve and the partnership between Dr. Artz and I in culinary medicine in providing plant-forward options and making the right choice the easy choice is really been an incredible journey, and excited to talk to you about it today.
All right, well, thanks again for inviting Kevin and I to talk a bit today about what we like to say, really bringing healthcare into the kitchen, really with the premise being that food is medicine, that we can use it as a tool to improve our health. And we've really developed here at Spectrum Health programs around how we can both educate patients and employees as well as community members, how to really take the science of food and nutritional science and translate that into practical skills that they can use in their home kitchen, that they can draw upon when they're at the workplace, for example, and how it's so important to really establish and build collaborations within your own organization to bring about this culture change that's oftentimes required so that we can all kind of move along the same path of trying to improve our health, maintain our health, sometimes even use lifestyle habits and food in particular to even reverse disease at times. So I'd like to take the first several minutes to really kind of set the stage of where we are in healthcare, what it means in terms of the root causes of chronic disease, and again, how we might use food as a tool to really improve our health. I'll talk to you a bit about some of the programs we have here at Spectrum Health and that really important collaboration that Kevin and I have been able to foster and develop between our service lines within the health organization. So again, I'm Dr. Kristi Artz. I lead our lifestyle medicine practice here at Spectrum Health. This is a new and growing area within our own healthcare organization, and you'll see examples of this that are growing around the United States, again, really trying to address the root causes of chronic disease. So we're going to focus on several items here, as I mentioned, really that role of lifestyle and culinary medicine and trying to help shift our health behaviors. These are not easy topics. This is entirely about behavior change, both at the individual level and also more broadly at sort of that community level as well. And how do we programmatically set up ways by which we can really partner with individuals, partner with organizations to bring about that change? What happens when we think about food as medicine, and how can we use what we know from nutritional science, but make it really approachable and easy for people to understand? And then we all know that the environment that surrounds us, whether it's at the workplace or at home, really impacts the choices that we make or our access to choices. So specifically within healthcare, we have pressures from all different places right now to really be dynamic, to change, to address the challenges that we're seeing within healthcare around the quality of care that we provide, increasing access and efficiency, and really trying to address, again, those root causes of chronic disease, which drive many of our patient care visits, many of that episodic care that we see within healthcare. And it's a large business, and we employ many different healthcare workers to help our patients in our community to hopefully maintain their health. But currently within the US, we spend trillions of dollars annually to care for individuals and their chronic illnesses like cardiovascular disease and diabetes, chronic kidney disease, dementia, and stroke. So, a multitude of different chronic diseases that often have similar underlying mechanisms. Much of the cost is attributed to the treatment of chronic disease. And with lifestyle medicine, with using things like food as medicine, culinary medicine programs, we can start to address some of those underlying or root causes of chronic disease. Again, this epidemic touches all parts of our community, even amongst our family members. 6 in 10 adults in the US have a chronic disease, and many have more than one chronic disease. So when we look across our community and how we care for patients, for example, in the healthcare organization, we have to be able to look more comprehensively at that particular patient, and that would include our employees. Many of our own employees are being treated for these same chronic diseases, and how might we really usher in more true health care so that we can both prevent, better manage, and possibly even reverse chronic diseases. Pictured here many of our habits that we are all familiar with, knowing that these drive chronic disease, but it's really challenging to change many of these behaviors. So that sedentary lifestyle, our current food system that is heavily reliant on processed foods and animal products, which science shows us really drives chronic disease. And then certainly our other habits, such as tobacco or alcohol use, and how these types of behaviors, especially as they build upon one another, can really, again, drive that epidemic of chronic disease. And we are seeing epidemic proportions, as I mentioned earlier, and many of us don't do the 4 healthy behaviors that we saw represented in sort of those poor lifestyle habits. Many of us actually on a daily basis are quite sedentary. We maybe smoke cigarettes, knowing that these can impact our health outcome, but yet we find it very challenging to change those behaviors, promote healthier habits so that we can improve our lifestyle, and our risk and resilience to chronic disease. Lifestyle medicine, of which that's an area that I'm involved with here at Spectrum Health, really trying to lead programmatic ways in which we can partner with patients around what we call these 6 pillars of lifestyle medicine that include optimal nutrition, better sleep hygiene, daily movement and exercise, avoidance of substances, really finding ways that we can manage our stress better, and oftentimes that's related to the prior health habits that we just mentioned, the nutrition and sleep. And then how do we use social connectedness and our relationships to really support those changes and really drive that behavior change to be better, feel better, live a healthier lifestyle. So that pillar of nutrition in those pillars of lifestyle medicine, the way we've envisioned this here at Spectrum Health is through our culinary medicine program. And here's a little definition of how we like to describe culinary medicine. It really blends the art of cooking with the science of medicine. And trying to partner with patients, with individuals, with employer groups to really work with the tools that can help to create a healthy meal, knowing that this is all based on scientific evidence, patterns of eating that truly support health. But we oftentimes can't do that unless we've developed those basic culinary skills. And the program has grown dramatically over the last several years, but in great partnership with our local culinary program at Grand Rapids Community College, the Sekia Institute for Culinary Education, and our national partner site with Health Meets Food, previously out of Tulane University, now at George Washington University, and finally at the Downtown Market, where our current lifestyle medicine practice is located. I'm physically here in our teaching kitchen practice location, where we will be seeing patients, we will be partnering with patients to really improve those lifestyle habits, both virtually and in person at some point when we can get back to more of that in-person education. So specifically around culinary medicine and using food as medicine, we, as I mentioned, over the last 50 years, there's really been a dramatic increase in the amount of nutritional science that really points us toward a plant-forward diet as being optimal for health. So culinary medicine really looks to the science to create ways in which we can prepare our food. And it's not meant to adhere to any one cultural tradition. So even something like a Mediterranean diet can be re-envisioned with different spices and herbs and ways that we approach foods so that it's relevant to all populations. This is meant to promote health. That's really the end goal, is that we implement culinary medicine and food as medicine, similar to as ways in which we would prescribe a medication or a procedure, for example. It's meant to be approachable and low cost. Oftentimes when we move toward that more plant-forward way of eating, we can also reduce our food costs, which is quite fascinating. And Kevin might speak to that a bit more in what we've seen with the Michigan Street Market and Grill at Spectrum Health. It's meant to be very experiential learning, so hands-on, getting to know the foods, really working with foods, whether that's in your home kitchen or here in the teaching kitchen space with us. We want it to be delicious. We want people to really move toward these patterns of eating and these health-forward ways of enjoying their food because it tastes delicious and it's just what they want to do, and their palate changes as they improve their food habits. And then finally, last but not least, is that we know that many of our choices can impact the environment, and the choices around our food can greatly impact our environment. And how might we begin to think about that, infuse that in how we serve our food at the hospital, for example, the types of food that we serve, and what is the impact that that's having on our local community and kind of the health of the planet in general. So to envision this a little bit more and what we're doing here with some of our patients and our employees with programs that are upcoming, I'd like to take this composite patient to really kind of wrap our understanding around the challenges that individuals face. And here we have pictured, we'll call her Karen. And Karen's story is she's busy. She is a healthcare worker. She comes to work every day. She has children at home, but she wants to manage her health better. And if we think about someone like Karen, who's approaching middle age, not knowing what's happening with school, but yet we still have our own work to be concerned about. On top of that, our own health habits, and how do we start to build in those habits for our own well-being, but also then for those around us, including our family members, our coworkers. This is an example that I like to show as where we often start from with individuals is the standard American diet or the SAD diet. Whereas I mentioned earlier, oftentimes it's heavily focused on processed foods and animal products. Very little fruits and vegetables are consumed, or beans, legumes, things like that are typically not standard fare for many individuals who eat a standard American diet. And if we think of our hypothetical patient, Karen, if she is coming into a work environment or a place that she enjoys eating, what are some of those environmental cues that either support healthier habits or drive more of the standard American diet, which we then know either now or down the road is likely to then be one of the causes of, for example, diabetes or overweight or cardiovascular disease. What we know as well is that standard American diet, as it drives chronic disease, it also drives chronic inflammation. And that's where we start to get to that root cause of how our chronic diseases are quite similar in many ways. And we oftentimes try to think of them as being separate processes. If you have a stroke, that's a problem with the brain. If you have a heart attack, that's a problem with the heart. But what we understand is that it's oftentimes this underlying inflammation, this damage to our vascular system, for example, that can often drive many of these different types of chronic diseases. So when we start to get to that root cause and start to work with those lifestyle behaviors or dietary change, we can oftentimes improve all of these manifestations of chronic disease. So culinary medicine is one way in which we can do that, where we can take someone with wherever you come into the teaching kitchen with the current dietary pattern that you follow, and those incremental changes that we can start to help patients make changes, all based on scientific evidence, but translating it into a way by which it's easy to understand, that it's very food focused. Rather than talking about a carbohydrate, let's look at some whole grains and beans and start to understand how to implement those healthy foods into our diet. So we get to that aspect of that fundamental nutrition knowledge that's so helpful when we're trying to make choices in our diet. And then again, as we mentioned, it oftentimes can equate to lower grocery bills, which we all enjoy when that's the case, because many of our whole foods are often quite affordable. So things like beans and whole grains, again, can really round out and be the basis of a nutrient-dense diet that's going to decrease chronic disease and oftentimes can be less expensive. And then, as we mentioned, the culinary side of culinary medicine is really teaching those hands-on skills by which patients can and community members can really implement some of these dietary changes and make them meaningful and impactful in their own life. Here's some photos from programs when we were in person with our culinary medicine programming. Pictured on the left, we have families that we invite into the teaching kitchen who are referred from our pediatric and family medicine offices and many of our surrounding practice locations in the community. And setting up programs where we meet individuals and families multiple times over a series of 2 to 3 months and really try to partner with them and support them as they make changes. We work with our dietitians who are part of the nutritional services division that Kevin Voss leads. We work with our residents and practicing physicians and bring them into the teaching kitchen so that they can also be learning these skills, learning that nutritional science so that they can share those skills and that knowledge and information with their patients as well. And again, we partner with the Grand Rapids Community College, the Sequia Institute for Culinary Education, and many of their culinary students actually partner with us and help to lead some of these classes as well. Our current environment is virtual, and so we have taken what we've learned with our programming in person and transitioned that into the virtual space. So we haven't stopped. We've continued to offer classes. We want this education to be accessible, and that's one of the really fabulous silver linings that we found with this new virtual environment is that we can reach people far and wide. They love being in the comfort of their own home, using the equipment that they have available to them in their home. So we've continued with a strong presence with culinary medicine. Just want to highlight a couple things that we're proud of over the last couple of years, all in collaboration with our partners and again with Kevin and his team, really seeking out grant funding so that we can reach many different patients, many different community members who otherwise may not have access to programs. If there are financial barriers, for example, we've conducted many classes, over 100 at this point, with all different whether it's physicians who are currently practicing, as I mentioned, patients that have been referred to programming. So really trying to make this programming accessible to all. And as I mentioned, we have fully transitioned this into our current practice location at the Downtown Market Teaching Kitchen, which is the practice site for the Spectrum Health Lifestyle Medicine practice. As you mentioned earlier, COVID-19 has really amplified the importance of healthy lifestyle to prevent and potentially reverse chronic disease. We are trying to take what we've learned with chronic disease as being a risk factor for COVID-19, and as I mentioned, continue to make virtual programming available even as we previously were sheltering at place, or now just trying to be more aware of how close we are with others in the community as the virus still continues to be present, but still trying to bring this education to our community members. And I'll just leave with the last couple of items here before I pass it off to Kevin, that in partnership with Kevin and his team and some of the changes that culinary medicine as a program has been able to help to foster that culture change within Spectrum Health as a whole by elevating that conversation around food is medicine, allowing us to have more conversations around what the nutritional science shows, how we can really look to our chef colleagues as being experts in their area of creating delicious food that can also happen to be incredibly healthy, and that's really what the goal is. And through lifestyle medicine as a program, trying to infuse those lifestyle behaviors, culinary medicine being one of those. I'm just going to kind of set the stage for what Kevin is going to show, some of the amazing changes that we've seen within our own cafes within Spectrum Health, but moving toward this win-win plate. We looked at the previous standard American diet plate, and this one looks vastly different. So really basing this plate on whole plant foods, whole grains, beans, nuts, seeds, and legumes, using animal products more as a condiment if we include them at all. This is a diet that promotes health. It's supported by science, and it's also healthy for the planet. I love these concepts taken from Menus of Change around what plant forward means, what it can look like, and it's really a style of cooking. And this is what we really try to bring to life in our culinary medicine program. And even for patients who have chronic disease, really encouraging and implementing as a treatment plant-based eating. So exclusively following a plant-based diet based on scientific evidence that can show reversal of cardiovascular disease, sometimes diabetes as well. And we love to highlight that, to show it in our cafe, and I'm going to hand it over to Kevin now, and he can talk more about how this collaboration and culinary medicine and the work that he leads with his teams has really brought about this culture change in food as medicine.
Thank you, Dr. Artz, and thank you for such a great introduction or presentation on culinary medicine. And it leads perfectly into how nutritional services has partnered so well with lifestyle medicine at Spectrum Health, and really looked at the opportunity around changing the environment and how that can contribute to making better food choices. So what you see in front of you on the slide is the mission statement of the Michigan Street Market and Grill. And the mission statement of the Michigan Street Market and Grill reads, "Whole foods, sourced locally and prepared fresh in our kitchens to nourish our body, mind, and our community." And that was the mission statement that Dr. Artz and myself and some other teammates came up with when we were planning a renovation to the main cafeteria in our downtown Grand Rapids Medical Center. We thought that this mission statement really elevated the opportunity we had to create something that employees and physicians viewed as a benefit, patients and visitors experienced as unexpectedly positive, and promoted a thriving community. So that was our goal of this mission statement. And before we move to the next slide, let me just talk a little bit about where we came from and the impact that we knew we could have. So for those of you from West Michigan, you may have visited the Butterworth Medical Center, and you may remember Prism's cafeteria, which was built in 1978. And it was built when we only had one tower. So there was no Helen DeVos Children's Hospital, there was no Meyer Heart Center. And that cafeteria became quite popular because it had a captured audience, right? As many of you employers know, your employees have minimal time for breaks. And if they haven't taken the time to plan ahead and bring their own lunch, often their choice will be at your place of eatery, your eatery or cafe. So what we serve there has a great impact on the health of our employee base. The old Prisms grew to about 3,200 transactions a day, about a $6 billion restaurant. So just to put that in perspective, we're serving a lot of food. And we thought we could do better. We also thought about this part about to nourish our community, and we looked at the local spend that we were doing, how much food we bought locally, which gets into whole foods versus highly processed foods. And the old Prism's cafeteria was only spending about 3% of their food spend locally. And we thought, what a great opportunity to promote a thriving community. So we opened Michigan Street Market and Grill back on March 4 of 2019. So it's been about a year and a half, and it's had a lot of great success, and it's become West Michigan's busiest restaurant by gauged in annual revenue. Before COVID and before we had our visitor restrictions, it was on track to do about $9 million annually. So we've increased almost 50% in dollars spent, which is a great testament to the type of food that we serve there, and it being delicious as well as very good for you. And we knew that we also could have a great impact by changing the environment, because before we opened Michigan Street Market and Grill, the old Prisms, we did some trials with. So we took the first 500 square feet where you entered Prisms, and we renovated it, and we made it look like a fruit stand or your produce section. And through that renovation, we learned that we increased fruit sales from 700 pieces of fruit a week to about 3,000 pieces of fruit a week. So just by changing the environment, by the placement of the food, as well as just the beautiful nature of fresh fruit and the colorful vibrancy of it. You also saw that on Dr. Artz's reimagined plate of food. It is just much more colorful, that we were able to really change what people grabbed. And we also did a pilot in the old Prisms, where we changed the placement of our beverages or sugary beverages. One of the favorite questions I get asked as running nutrition services in a hospital is, do you have a fryer, or do you serve fried foods, or do you serve pop or soda? And the answer is that in Michigan Street Market and Grill, we serve both of those, but we don't make them easily findable, and we don't put them in the prime location. So in my introduction, I talked about making the right choice the easy choice, and that's what we've done here. So this slide is the new Michigan Street Market and Grill, and it is the entrance to the Michigan Street Market and Grill, and it is inviting you to make the right choice. Behind the fruit, you can see non-sugary added drinks that are good for you, and there is no soda pop that you can find in this section of the market. And we know that we've changed behavior, because in Prisms, 1 in 10 drinks was a non-sugar sugary added drink, and now 4 in 10 are non-sugary added drinks, because of the placement and the pricing and the promotion of those items. So, and one thing that's important when we're looking at the data around what we're selling in Michigan Street Market and Grill is we actually put diet soda in that non-healthy category because of some of the additives that we don't want to promote. So when I'm talking about a shift from 1 in 10 being a good beverage to 4 in 10 being a good beverage, and we aren't talking about diet soda being one of those good options. We had 3 objectives in creating that aligned with that mission statement that I started out with. 1, we wanted to focus on food menu choices that impacted the health of the community. So how can we transform this hospital cafeteria into a place that you're excited to go to and looking forward to what they're serving, because 1, you knew it was going to be delicious, and it happened also to be very healthy and help promote a thriving community and health of our workers. We also wanted to focus our food service jobs to impact the wealth and job stability of our community. So really looking at not only what we're purchasing and what we're serving, but also how we're respecting our employees. And it's exciting to report that we've brought our culinary teams into the teaching kitchen and given them training on culinary medicine, which has helped to promote the concepts and actually helped educate the people that are actually doing the cooking, and they're actually coming up with some delicious plant-forward meals themselves now, which just really spurs the excitement of Michigan Street Market and Grill. And we also had an objective to focus our food spend to better the local economy, to keep the dollars within West Michigan. And we've had some great success with that. So the next slide is a picture of a beautiful farro beet spinach salad. So again, whole foods, whole grains. It has a blood orange infused vinaigrette dressing, and you would see this after that first slide that I showed you of the fruit produce stand. Is the next place that you enter into Michigan Street Market and Grill is this beautiful two-sided salad bar. And on one side of the salad bar, we have the traditional make your own salad, where you have numerous toppings and different local greens that you can buy. But on the other side of the salad bar, we have what people have gotten used to in kind of artisan delis, where you can get composed salads such as this beautiful farro and beet salad. And by putting the salad bar as the main attraction, we have moved salad purchases from about 7th in our menu sales analysis to the #1 ingredient, to the #1 thing sold in our Michigan Street Market and Grill. And it's because of the placement of the salad bar, but also because of the culinary talent that's making delicious food like this. And I certainly love eating this salad every day. In fact, I think when we were touring, Dr. Artz and I were touring when we were early February prior to our March opening, and I was showing her, usually this side of the salad bar has about 6 different salads that look like this. And she recommended, could you put a bowl of lettuce next to this side of the salad bar, because I would love to just get some lettuce and then pile on 2 or 3 of these salads, and that would be my meal. And we started that as we opened in March, and it is a tradition that people just love. This is one of the most enjoyed places in all of Michigan Street Market and Grill, and really promotes the types of food, the plant-forward food that we really want to, and that is evidence-based that Dr. Artz speaks of. The next slide after this shows a beautiful chickpea sandwich. So this is a vegetarian sandwich. I would highly recommend trying something like this if you're the type of eater that says a sandwich isn't a sandwich without some meat on it. This is delicious, filling, and something that you can get in as you go around the salad station in Michigan Street Market and Grill in the artesian deli. The bread that you're seeing here, for those of us from West Michigan, is from Field and Fire, which is in the downtown market. It's a great bakery, and we made a commitment to Field and Fire that the only bread that we would serve in Michigan Street Market and Grill, the busiest restaurant in West Michigan, is Field and Fire bread. One of the successes, and going back to that kind of pillar of could we focus our food spend to better the local economy, is that Field and Fire had to hire additional employees to handle the volume because of the buying commitment that we made to them, which just shows how a health system can really use their spend, their supply chain dollars to really anchor a community and better the community through local investment. Next to the artesian deli, where you can get these sandwiches, in the back of Michigan Street Market and Grill is the grill. And there are some stories there around how we've moved, by changing the environment, we've helped people make better choices. And while you can find a traditional hamburger there and French fries, that hamburger now is a 4-ounce hamburger, not the 7-ounce hamburger that we used to serve in prisons. But you can also have 4 other choices in that grill station, which is a 4-ounce chicken breast. That's an all-natural, antibiotic-free chicken breast. or a piece of salmon, or a blended burger, or a vegetarian alternative burger. So we've not only reduced the ounces of meat-based protein in our burger, we've given you options to choose from in case you're curious or want to try something that is maybe new to you to experience. And I'm happy to report we still have hamburgers and French fries, but we've seen a dramatic shift in people's buying patterns, and even to the point that almost a 20% reduction in our fried food. Should highlight a few of those accomplishments that go back to the objectives I spoke about. Through the objectives that we had, we've hired 34 new employees, which gives back to our community through wages, but also have many development and career pathing programs for our employees. We've also increased our local spend to approximately 20%, which gets close to $500,000, and have increased our partnerships with our diverse partners within the community. And really, through the placement of delicious foods, we've changed the food menu choices to a healthier mix. And we also took a chance to make this change to eliminate styrofoam from our cafeterias, which was welcomed by our employee base. So the following slide is where we are going now. We continue to grow our partnership with Culinary Medicine, which is exciting, and really thankful, Dr. Artz and I, as well as the rest of our teams, to our senior leadership that they continue to support these efforts. There's a Cool Food Pledge, which is partnered with Health Meets Food organization that studies the amount of plant-based protein or in each serving of food. So we are participating. 2019 was a baseline studying year. 2020 will be our first year where we look at the difference in how much plant-based protein in a serving of food versus meat-based protein we have. So that will be helping us really add validity to the changes that we've made. Also looking at our policies around healthiest workplace, and if there's any opportunity there for Spectrum Health to encourage healthier behaviors through some of our policies. Looking, there's a team that Dr. Artz is on, as well as Chef Mick Rickard, to revamp our patient menu, because clearly serving food in a cafeteria really needs to be modeled also at the bedside, so that's a great opportunity as well. And we have a sustainability commitment to increase that 20% local spend to 50%, which is part of the Michigan Good Food Charter by 2030. So all exciting initiatives that really hopefully highlight to you all that by changing environments, there is an ability to change behaviors, especially with improving employee wellness. So.
Wonderful. Thank you so much. That was really great. So I'm going to kick off with a few questions, and I'm going to switch up the order just a little bit. The first question that I had, and I'll let either one of you jump in on this one, is in case some people are wondering where to begin. A lot of people don't have a big remodel for a food service department, or they just have their existing facility, but they want to start to incorporate some of these healthy nutritional changes in their workplace. So what are some of the first steps you would recommend that a workplace implement to improve those nutritional standards or healthy food options?
So Dr. Artz, I'm sure you have some ideas here too, but I'll just tell a little insight from our story. Is we gained significant traction at Spectrum Health by just changing the catered meals at really intentional meetings that we knew we had decision makers at. And that is actually where we started getting emails the next day around what was in that you served, or I can't believe a hospital can actually cook food like that. I mean, even questioning the culinary talent we had. And that really helped us establish a platform and kind of to move things forward.
I would agree with that. And another place that I can kind of illustrate some of the ways that you can change in real time is, for example, we have hundreds of residents who train in our hospitals. And even just searching around, there are small grants available. There's one in particular that we've leveraged several times through the American College of Lifestyle Medicine. It's called the Taste of Lifestyle Medicine. And it supports healthy foods being offered at presentations or didactic education. So again, as Kevin mentioned, think about those opportunities where your employees may be gathering now, maybe remotely, but where you can really get that audience where people are exposed to different foods and flavors, and bringing in some of these options that taste delicious that also just happen to be healthy. And I think we always try to lead with that rather than saying, here's your healthy food, just make it taste great. And then people naturally start to make some of those changes themselves.
So being really realistic, what are some of the biggest obstacles or resistance that you met when you started to look at changing over your food service?
Dr. Artz alluded to this during the talk, but there is a perception that healthier food is more expensive. And I think if you do the math and you really can get buy-in, and the way to get buy-in, again, is make it beautiful, is that a lot of these beans and whole grains can reduce your food cost. And that really was something we had to talk through and help educate. I would also say that in a healthcare setting, we often have a certain culinary talent that's been long tenured with our organization that is used to cooking, I'll say, more processed foods. So there really was an education gap around or even change management gap around getting the culinary talent up to speed if needed, and when it wasn't needed, really just excited about this because they felt like it was going to be more work to them to cook these less processed foods but healthier foods. So pricing and really skill training would be my two obstacles.
I think from the more clinical side, there's still a perception that I think is improving, but that by eating more plant-based, that will develop protein deficiencies and not receive the nutrients that we require for our bodies. And clearly that's never been demonstrated in the evidence, especially if you're eating a diet that has variety with lots of different fruits and vegetables, nuts, seeds, legumes, whole grains. And, you know, a lot of fad diets and a lot of misinformation out there that really just perpetuates itself. So again, we always try to draw upon the science and then pair that with food that just tastes great. And I think leading with that, oftentimes you can roll with the resistance a little bit better.
And I'm going to tag a little bit, Kevin, on what you were talking about on price. You had mentioned when we had toured the facility there that you were very budget conscious and had to realize that you've got a range of consumers that may have very limited budgets. So can you just share just a little bit about how you were very conscious on setting pricing in a way that anybody within any budget frame could eat nutritious meals?
That is definitely a challenge. We have 31,000 employees across our health system, and from people making $12 an hour to very, very generous higher salaries. And so how do you create a restaurant that can cater to both? And the way that we did that was really conscious around a la carte stations and pricing things like by the ounce. So that salad that I showed you is sold by the ounce. So if you wanted that salad, and that salad, we also try to promote a lower price than maybe the French fries. But really through a la carte stations where you can choose how much you want or of what you want, we were able to allow there to be nutritious meals that range in the $3 to $4 range, or nutritious meals that had some more extravagant ingredients that were in the $7 to $9 to $10 range. So really giving people choice and making sure that there was a variety of choice was how we handled that.
And many companies don't have food service facilities at all. Rather, they just offer vending machines. So how would you suggest that healthy eating options can be brought into smaller companies or those with very limited facilities?
Yeah, so this choice that I'm speaking of and COVID has had some impacts on that, such as communal buffet type serving has been shut down. And it's been shut down in Michigan Street Market and Grill, just like it has been shut down at your local commercial restaurant. So we are currently looking at a vending machine that you can buy that automates 41 different salad ingredients inside a vending machine, and it integrates with our payroll deduction program. And we will be looking at unique tech solutions like that are really becoming a lot more common, especially because of some of the challenges of serving food at employees' places of work due to COVID. So there are tech solutions out there, and if you're interested more in that company or some of the others that we're looking at, you can feel free to contact me. We have our contact information on that last slide.
So how do you incorporate the education and the messaging about healthy choices to your staff? So there's not just a big changeover where the items have changed, but they're really understanding the why with what you're doing. Things like reducing sodium content or eliminating sugary beverages. How do you weave that into the changes in your nutrition offerings?
Well, you know, I would say, again, that's sort of the beauty of what culinary medicine does, is that it takes whole foods and we learn to work with them and serve them in really delicious ways where you automatically don't have added sugars, added salt. So I think we do, to some degree, you know, despite all the great things we have with technology and convenience foods, we really have to get back to encouraging more of that slow food movement, and that cooking at home and bringing your food to work at times it's not just helpful to your budget, but it's also, you know, it's treatment for you to help prevent chronic disease, for example. And I think really providing that direct link, showing studies to individuals, whether they're physicians or community members, that within 2 weeks of changing your diet, you can actually lower your blood pressure. I think these are really impactful education moments that we can present to our community. And as Kevin mentioned, that amazing opportunity at the bedside that we're going to have, especially as we make changes in the menu items there, that what they're being served, what a patient is being served for their meal while they're hospitalized after their cardiac bypass surgery, we can now demonstrate, or soon to be able to demonstrate, how we would really like them to eat when they return home, and knowing that it's not going to go from 0 to 180 immediately, but how do we incrementally encourage those changes? Yeah, so, and I think another great opportunity, I'll just leave this and then pass it to Kevin, is really elevating that role of a dietitian, and that's the other important thing that we've really tried to draw upon within culinary medicine, is that we have this amazing resource available to us that's underutilized. So trying to give them the credit that they deserve so they can share that nutrition education and message more loudly.
I would only add, we've done this through alignment and really through partnership. So for instance, all the promotional material around healthy eating in Michigan Street Market and Grill has been reviewed by Dr. Artz, by our dietitian team, and you don't hear a certain message from the lifestyle medicine team and hear something different when you come into the cafeteria. So for those of you employers out there, if you do run your own food service, or if you contract the food service out, getting that food service leader tied in with your workplace wellness program and making sure that they're communicating the same language is very beneficial.
Yeah, we had an example from one of our companies at the last West Michigan Wellness Symposium that was trying to educate his team about sugary beverages. And they gave free beverages to everybody who worked out on the shop floor. And so as you can imagine, people were filling cups of sugary beverages that were huge, and they didn't get permission to quit serving the free beverages. So instead, he got permission to do a poster board above all of the different drink spigots of how much sugar was in each one. And he had a Ziploc bag of sugar. And so this is how much is in that 16-ounce cup, and this is in that 16-ounce cup. And it started to shift the behavior of what people were actually drinking. And we thought that was just a great and ingenious kind of idea. But you're right, his role was with wellness. And so he worked with the food service department on saying, we really need to shift some of the education around what we're doing so that people can make a healthy and informed choice. So, well, I'd like to thank you both so much for sharing the information that you brought with you today. And in our discussions, we shared ways that company leaders, HR and wellness professionals can start to implement those changes and improve nutrition in their workplaces, exactly like you've done there at Spectrum Health. The American Heart Association does also have a great free, healthy workplace food and beverage toolkit that any employer or HR professional can use as a guide to improve education awareness or even improve your healthy food options in the workplace. And you can download that healthy, free workplace food and beverage toolkit from our West Michigan Wellness Symposium event page. You're going to find that at heart.org/West Michigan Wellness. And again, I'd love to thank Dr. Kristi Artz and Kevin Voss joining us from Spectrum Health today and sharing the importance of culinary medicine and also your real life experiences with making changes in the workplace. It was wonderful. I'd also like to thank again our generous sponsors, Meyer, Beist Electric, Priority Health, and Terryberry for making the West Michigan Wellness Symposium series possible. Because of your support, the AHA can continue our critical work of helping to close those gaps and disparities of health too. So we hope you all join us next week for session 3 in the West Michigan Wellness Symposium. It will be on Wednesday, August 26th at noon till 1 p.m. Our presentation will be how to create a healthy environment in the workplace, all about the workplace and workspaces, and considerations needed to build a healthier environment, whether your business is big or small. And there's some great information there. So we hope you join us next week. Take care, everyone, and stay healthy.
Hi, I'm Tony Sproulbaum, the Vice President of Wellness at Health Plan Advocate and the proud 2020 chair for the upcoming Grand Rapids Heart Walk. I've been a passionate volunteer for this Wellness Symposium committee for the past 3 years because I just love the AHA's mission to build healthier lives for all. One of the founding values of the American Heart Association has been health equity, and because of your support, they're working to close the gap in the disparities of health. Coming up, I'd like for you to watch a video about the impact of the AHA's work in West Michigan. I'd also love to invite each and every one of you to support this work by participating in either the Grand Rapids or Kalamazoo virtual Heart Walk, coming your way during the month of September. We're going to practice healthy habits all month long and then celebrate the virtual Heart Walk event on Friday, September 25th. You can register online at grandrapidsheartwalk.org or kalamazooheartwalk.org and get heart walking to build healthier lives. Thank you so much, and I look forward to virtually walking with you in September.